Thank you, Mr. Speaker, and I want to first of all salute Congressman Doggett for his effort in terms of bringing this legislation forward. As the chairman of the committee said, this is really about giving patients a fighting chance to challenge this coding change that happens while people are in hospital and have absolutely no idea that they're not being treated as full Part A inpatient patients at hospital facilities. The impact of being coded as observation versus inpatient may sound extremely arcane, but what that means is that at time of discharge, if a patient is medically prescribed to go to a nursing home for rehab care for a broken bone or for home health services for a heart condition, they are not covered by Medicare if they're in the observation bucket as opposed to the inpatient bucket. And the Inspector General's Office for Medicare issued a report in 2012 that 600,000 patients across the country with long-stay hospital visits over 3 days fell into this black hole, this no man's land, where they, again, their doctors are telling them that they need to have rehab services so that people can walk again and deal with activities of daily living. But the price for doing that, because you're in observation status, can be tens of thousands of dollars, which is where long-term care facilities, nursing home coverage for private pay patients, out-of-pocket patients exists today. This bill at least gives patients the opportunity to challenge that decision. But the fact of the matter is what we need to do is to restore the 3-day rule, which is in statute. It has been there since 1965. Observation status is something new within the last 10 years. And what we need to do as a Congress is to restore that 3-day rule, which says to a patient, you know what, if you're coded observation or if you're coded inpatient, it should not interfere with your medically prescribed course of treatment at the time that you're discharged from a hospital. And that, unfortunately, is not going to be fixed as a result of this legislation, but we should build on this legislation and, again, restore Medicare's promise, which, again, from day one has said that medically prescribed care will be covered by the system at time of discharge from a hospital for longer than 3 days. The horror stories of people who, in some instances, were in hospital for 9 days, broken bones, broken hips, who, again, are staring at a $10,000 to $15,000 fee to be admitted to a nursing home. Again, 600,000 cases in 2012. So again, we need to build on this legislation, but fundamentally we need to restore the 3-day rule, which has been in statute since 1965. We will be introducing that legislation later this week. It'll be a bipartisan bill. Again, we think we can withstand the test of any pay-fors to make sure that it, again, allows the Medicare system's finances to stay in a stable condition. But in the meantime, we should pass this legislation today. And again, I want to salute the member from Texas for his leadership on this issue. With that, I yield back.